Okay, we're back. Welcome back to Anesthesia 101 Online.com. I'm your host, Siv. This is episode 7? Yes, I think it's episode 7. So today we're going to talk about airway nerves. So we'll go through some airway nerves. As you can see, I'm sharing my screen right now. I have a Microsoft Word's table outlined here. I also have this one here. This is the diagram of the laryngeal airways, so we'll take a look at those too. So what else? Well, let's go back. Let's start from the beginning. So we'll just mainly look at the nerves that would concentrate as far as anesthesia wise. So we're just going to look at these specific. I can't say the word sometimes. I don't know what it is. Specific nerves we'll be looking at tonight. Will be cranial nerve number 5, the trigeminal nerve. It's a nasopharyngeal nerve. It's mostly a sensory nerve that comes through nasal cavity. Obviously, the nasopharyngeal, so that tells you what it is automatically. And sometimes you'll see these highlights where I put the, where I got it from, my Barish book. Mine might be outdated, maybe 3, 4, maybe 5 years old. I just graduated about 5 years ago, so these are relatively new, you want to call it that. So the cranial number 5 is nasopharyngeal, also known as the nose. I put it in bold letters. Cranial nerve number 7 is the facial nerves that controls the face. It's a sensory of the face and then the anterior 2/3 of the tongue. This is it's a wording that they like to use in the national certification. 2/3 of the tongue, you'll see it in your exams too. So always remember that cranial nerve number 7, 2/3. So emanates from cervical 5, and it mostly innervates the facial nerve, temporal, zygotic, buccal, the mandible, cervical area. And I got that from Negahout or Negahoot, whoever. I don't know how you guys pronounced it, but that's what I got. Next, we'll move on to cranial nerve number 9. That's the glossopharyngeal nerve. Controls most of the oropharynx, the tongue, the lateral aspect of is medial to the internal carotid artery, and medial and then internal to the carotid artery, and then passes superficially along the posterior tonsillar pillars. So the essentially is your gag, your reflex, the vomiting reflex, so reflex secretions, and then this part is you see how cranial nerve number 7 is the 2/3 of the tongue, and then the complete portion, making it full complete portion, will be the posterior 1/3 of the tongue. So 7 and 9 are pretty much close together there. So it has sensation of free edges and soft palates. The platoglossal folds is where it's located. So mostly where this is, it's this superior anterior aspect of the epiglottis, submammary, and the walls of the pharynx and tonsils. And cranial nerve number 10 is the vagus nerves. It's one of the biggest nerves. It kind of innervates everything, the vagus nerve, if you think about. This goes all the way down to your mesenteric artery, mesenteric covering, so in your gut. That's why if someone's pushing on your belly or you're doing a laparoscopic procedure where they insufflate the belly, that's why those nerves gets reflexed back to the heart and gives you a vagal stimuli, giving you a low heart rate. So it provides a sensation to the airways below the epiglottis. So that's another key point too, if you want to make note of that. Right, so write that down, for national certification wise. It provides the sensation airway below the epiglottis, the hypopharynx glottis, and below the trachea. The piriform sinuses and the fossa, they call them the gutters, basically right in the back of the sinus. SNL is a superior laryngeal nerve, runs superficially along here and lateral sides of the laryngeal pharynx. If it's a unilateral injury, it'd be a thyroid, like secondary to a thyroid surgery. You have injury to a recurrent laryngeal nerve, and then the superior laryngeal nerve damage. So you basically get hoarseness in that area. It's bilateral. You get a stridor, inspiratory laryngeal gas, you want to call it, spasms. It immediately needs ET tube, as you can see in red exclamation. I like using colors. You can see in my Microsoft Words here. I'm not too savvy with computers yet, so at this point when I was going to school, I was up in Maine, Portland, Maine. I went to University of New England in Portland, Maine. That's where I got my master's from. This is when we made these charts, or at least when I made these charts. So when you look at the cranial nerve number 10, this is the most important nerve that we're concerned about. So you got two splits to it. So the superior laryngeal nerve and the recurrent laryngeal nerve. Sensory-wise, it is the laryngeal spasm reflex. And then for recurrent laryngeal, motor-wise, is more of a sensational nerve. It's not an actual motor. Sensational cough reflex. This is the reflexive cough nerve. That's below the vocal cords, intrinsic muscles of the pharynx. So according to Barish, it controls the speech, opens the cords, inspiration, closes the swallow. And then I got here highlighted in yellow. Usually when I highlight things in yellow, that means it's important. So the base of the tongue to the vocal cords, larynx and base epiglottis, arytenoglottic folds and arytenoids itself. I like saying that word, arytenoids. It just makes it sound so intelligent. I don't know what it is. The external branches and a sensation of the recurrent laryngeal nerve. So it's, the motor is the cricoid muscles is the motor portion of it, and the sensation part is the actual internal branches. So when you look at the anatomy, let's click on the anatomy here. You can see as that this is the recurrent laryngeal nerve that comes up here. Kind of hits all these areas. That's why it's very close to all your internal carotid arteries in that aspect. And this is just a little. I got this from I think Google Images. Yeah, so you can Google all this stuff. None of this is mine, so whatever helps with the teaching aspect. So this is the superior laryngeal nerve block is what they're trying to show, and this is if you can do a cricoid block. If somebody just get a trachea, that'll be right there, the transtracheal block. And then you can look through your other procedure books that shows how to do a cylinder technique. Very cool. Probably YouTube it too. Anyway, back to our Microsoft Words table that I made up here. So where was that? Oh yeah. So cricoid muscles tensor of the vocal cords. Also controls the cricoid muscles, smooth muscles. You damage this, you get a huskiness in your voice. So to differentiate the recurrent laryngeal nerve damage, it's bilateral, you get aphonia. So basically you have no voice. Unilateral or hoarseness provides innervation of trachea and larynx below the vocal cords. And M&M stands for Morgan-McHale. Like I said, I don't think they call it Morgan-McHale anymore. I think they called Butterfield or something like that. Like I said, the time when I was taking these classes, the books were, had different authors. So but check with your literature, primary literature, what do you use? And it may not say Morgan-McHale, but I'm pretty sure Morgan is actually one of the authors, is still on there. And then you got the vagosympathetic chain. As far as the laryngeal sympathetic symptoms you get is tachycardia, acute hypertension. And then you got this is cardiovascular system. So you start to actually I use the acronym CVS just as to if you get these kind of stimuli, laryngeal signals, you get a cough, strain, and vomiting. So that's why I put CVS. And lastly, laryngeal vagal. You get laryngeal spasms, bronchospasms, apnea, bradycardia, and hypertension. And I just made a little couple notes down here. Again, some highlights. I'm glad I'm able to share. Let me zoom in a little bit better there. You guys might see that a little better. It's highlighted yellow, and that means it's important. So write that down if you need to. So a lot of people are just probably take screenshots of my screen anyway. So identify laryngeal abductors paired or unpaired. That's by Nagelhout. You'll see complete and single cartilages. So basically, when you're looking at the larynx, some books will have you describe, as you're coming down the airway, are they complete or single cricoid cartilages, and that's how you differentiate what anatomically, what area you're in when you're talking about those kind of areas. And then you get the paired arytenoids and corniculates and cuneiforms. So basically you're seeing the inside epiglottis into the vocal cords. And you could probably just Google an image because it'll be right around into the epiglottis, into the vocal cords back there. That's what's that describing. Abductor, adductor muscles. So these are good to know. I would write this down, memorize this, because some of these just straight memorization. So what I did was I said, but the posterior cricoarytenoids, the AB duct. So the AB duct vocal cords, and I've used the acronym PCA, pulls cord away, basically pulls your vocal cords open. Then the lateral cricoarytenoids, AD ducts, it adds, so it comes together, obviously. And then cricoids tends to elongates the vocal cords, so it stretches up, it gives you a pinch, basically you're pinching your vocal cords. Is what's the cricothyroid elongates. And the thyroid shortens and relaxes vocal cords up and down. So if you want to look at like I said, this from Valley I got here. Like I said, none of this is my disclaimer is that I use what I can, and this is readily available to everybody that has these programs. But mine may be a little bit older than usual. Let me move this over to center. So if you'll see them describe all the time. If you were as you're looking at the vocal cords, they wanted you to be able to describe when what they call it DL, direct laryngoscopy. What you initially see is your epiglottis, thyroids, cuneiforms, corniculates, arytenoids. So you have to know all that in which order from superior to inferior when you're actually looking at that anatomically area. Okay, that was it. I'm sorry I went a little fast, but I'm a little pressed for time. I got the kids. It's about late. You don't do these videos late at night, but the kids are up, so I'm just trying to get this in for you guys to have and to share. So come back again. My name is Siv. This is Anesthesia 1on1online.com. Reach out to me for any kind of information. Like I said, I think I mentioned it previously. I'll be starting a coaching call, a one-on-one coaching call via Zoom to help people study for their boards. So I'll be more than happy to help. Reach out to me. We'll get something going. So I'll talk to you soon.